Bismillahirrahmanirrahim. Welcome to the SJDA UK Personal and Professional Development Project. My name is Ahmed Adlan and I'm a cardiology registrar ST6 working in West Midlands Deanery in the UK, and I will be presenting to you about evidence-based medicine, publications and critical appraisal. This is a very large topic, and I'm going to split it into two parts. Today I will just be giving you a lot of background, and in the second part, which will be arranged at a later time, I will be doing a live journal club presentation to give you an idea of what a journal club involves. And at that time there will also be an opportunity for any questions and answers. So today I'm going to define evidence-based medicine. I will also talk about research and scholarship and how the GMC have recognised it as something that is important for every trainee to get involved in research. I will also give some advice about how you can think about getting involved within the hospitals in the UK, and I will also be describing what a journal club is and how you can prepare for a presentation at a journal club, and I will give you very practical advice about how to do this. For example, how to obtain any scientific articles, how to go about critiquing a scientific paper, and how to present that paper at a journal club. So the first question is, what is evidence-based medicine? It's something that we hear about a lot, and really the way I think about it is I compare it to experience-based medicine or traditional-based medicine, which is how medicine has been running for many centuries. So typically a doctor will see a patient, he or she will examine the patient, take a history, do some investigations and make a diagnosis. Then we'll start treatment for the patient and then follow the patient up to see whether or not that treatment helped this condition, or if it didn't. If it didn't, then the clinician may then reconsider the diagnosis and possibly arrange different investigations. And the idea behind this is that over time, when you see many patients, you get an idea of clinical judgment, and your medical practice is based upon your experience. In reality, a lot of people, particularly when I started off as a junior doctor, house officer and early SHO, most of the medicine that I practiced was actually experience-based, in the sense that I would treat patients in a way that I've seen other clinicians treat patients, my seniors. And the way that this sort of clinical judgment gets passed down from generation to generation, sometimes if you want to get if you want to get expertise in a particular specialty, you will go and spend some time working with a specialist in that area. So that's experience-based medicine, and it has some limitations in the sense that your experiences are quite random. Evidence-based medicine is more systematic, it's more planned, and you have an objective. You try to formulate a hypothesis. You have very well-defined groups and treatments, and the idea behind it is that there's less risk of bias. With experience-based medicine, there may be a greater risk of bias. For example, I had one consultant who would come and do an acute medical take 1 day a week at this particular hospital, and he would always just discharge patients all the time, and then he would go back to his other hospital for the rest of the week. But he didn't realise that when he discharged these patients, they would come back the next day or the day after, and then they would get readmitted. So really, experience-based medicine, you don't have necessarily specific follow-up of patients, whereas with evidence-based medicine, you do. Usually with evidence-based medicine, you're looking at a large amount of data compared to experience-based medicine, where often the number of patients that you may see with a certain condition may be relatively small. Evidence-based medicine is more reproducible. This means that if you did a study today and you repeated it next year or the year after, you get the same results, and you'd expect that similar studies performed around the world would give you similar results and reproducible. With experience-based medicine, there's no formal ethical review. You're left to use your own judgment and what is ethical and what isn't. Whereas with evidence-based medicine, there is a formal ethical review panel. Similarly, when it comes to publication, with evidence-based medicine, there is a formal peer review process. So peer review means that you have a group of specialist clinicians, researchers who will go through your results and your paper and will analyze it and critique it and make sure that actually your publication reflects what you've done and that there aren't any problems with the way that you've presented the work. With experience-based medicine, there's no real formal peer review. Often any experiences are rarely published. Sometimes you may find very specialist, famous, eminent doctors, when they're retiring, they may publish some of their experiences. The good thing with evidence-based medicine is that you have data and it's quantifiable. So for example, you can say to a patient, if you take this medicine, you will have 10% less risk of dying. With experience-based medicine, you can't really give that type of figures to patients. Now, if we look at the official definition for evidence-based medicine, which was formulated in 1996, it's quite complicated, and they seem to suggest being conscientious, that there's some hard work involved, explicit in the meaning that it's open, judicious, reasonable use suggests that there is a lot of thinking and weighing up of various things, and the best evidence in making decisions about the care of individual patients. So really the idea behind it is that you have a process to try to improve your decision making about how you manage your patients. Interestingly, the official definition mentions that evidence-based medicine integrates the clinical experience and the patient value. So whereas you can think of evidence-based medicine versus experience-based medicine, I think what they're trying to say here is it's using both, and I think that makes more sense, that you actually use your clinical judgment, that you see patients every day, as well as the evidence and the best evidence that's available to try to treat your patients. Now that's the theory, but what is it like in practice? So if you take a guideline, and guidelines are usually formed from the best evidence, so a panel of experts will sit together and they will analyse the most recent evidence before they can formulate specific guidelines to how you should treat and investigate your patients. And that's the theory behind evidence-based, but what is the actual reality? Well, the reality is they have to grade the evidence. They give a level of evidence, A being the highest level, and B, C being the lowest level. This is for example from the cardiology guidelines. So what they've put as the highest level of evidence is a meta-analysis of randomized controlled trials. A randomized controlled trial is a way to minimize the risk of bias when you're trying to look to see if a new treatment is better than a standard treatment. So for example, you may have a new drug that you want to use in a certain condition. You have two groups. One group will get the new drug and the other group won't get the new drug. And you can then follow the patients up after a period of time, say for example a year, or 5 years or 10 years, and then you look to see whether or not that drug had the effect that you were looking for. And you can compare to see whether or not there was any significant difference between the two groups. And how you decide which patient goes into which groups, that process is randomized. And the randomized nature of that process is very important, and that keeps the risk of bias very low. So if you have a number of randomized control trials, at least more than one, you can then collect all that information, all the data together, and do one analysis on all of the randomized control trials. That's called a meta-analysis, and this currently is seen as the best level of evidence. Now, the more you learn about research, the more you realize that actually everything has got limitations, and meta-analyses do have limitations as well. The level B evidence is a single randomized control trial, or an observational study, and again, the level of evidence is not as strong. And the weakest level of evidence, level C, involves case reports and also expert consensus. So for me that sounds very similar to what you would get with experience-based medicine. Once you've classified what the level of evidence is, then you will make a recommendation in a guideline, for example, and the class of recommendations in these guidelines from the European Society of Cardiology, for example, they have class 1, class 2A, 2B and 3. Class 1 is a recommendation that this investigation or this treatment should be done, and if it isn't done, you have to give some explanation as to why you haven't done it. Almost it's being negligent if you haven't done it. On the opposite end level, class 3 recommendation is that based on the evidence that we have available, this should not be done. This practice should not be done, whether it's a treatment or investigation, it should not be done. Again, if you do this particular treatment, then you'd have to explain why you did that, because that goes against what the best evidence tells us. Now, a lot of the guidelines and a lot of the recommendations actually fall in the class 2 category, where you have not full or inconclusive evidence, and if the evidence is a little bit stronger, then they may give you a class 2A, which means that you should consider this particular treatment or investigation. 2B is usually worded as may be considered. So again, if you haven't done it, it's not really a big deal. But if you do it, again, you haven't done anything wrong to the patient. So why is this important? Why is evidence-based medicine important? It's very important because it allows us, it's a process by which we can get the evidence, see the evidence, and apply that evidence to practice so that we can help patients. And the GMC recognise this, as something important, and they have a research and scholarship section or domain, and in fact it describes what is expected of a trainee, of a training doctor. And if you look at the blue circles and the red, that's really what's expected of all trainees. So number one, on the left hand side, you need somehow, we as a community, we need to have evidence. We need to participate in research to collect evidence, and my advice is that this is the best way to get involved and to learn about research, is by actually participating. But not everybody does participate in research. Still, the evidence will be there. What is so the GMC don't necessarily expect you to participate in research, but they do expect the other steps. So, for example, the first step is to perform a literature search, to look at the current literature in terms of articles and publications, and to see what exactly has been published on a particular topic of concern. Then you'd have to appraise. Once you've done the literature search, you then need to appraise the evidence, and I'll be talking a little bit about how to critique evidence and how to appraise evidence later on. You then make your recommendations or your conclusions, and you have to learn how to communicate these to your colleagues, and also you have to learn how to communicate it to patients. And this is what is expected of a trainee. The journal club is a very good way of covering all of these areas here. So with a journal club, you do the literature search, you appraise the evidence, and you communicate it to your colleagues. So I think it's something I will talk about a little bit later on. So just a slide about how to get involved in research. Most doctors, when they first start in a hospital, they will be assigned to an educational supervisor. Your educational supervisor is the first place really that I would recommend going to let them know that you're interested in taking part in research or getting involved in research, and they can give you some advice, particularly about who you can approach to help you with this. Most departments have a consultant who also is an educational lead, and they are also very useful to go and speak to and mention to them that you'd like to get involved in research. For example, in my last hospital, there were two of the international fellows. Those were the clinical fellows, international. They actually got in touch with the educational lead, who managed to arrange for them to do a master's, an MSc, at the local university. So again, the educational lead is also someone who you can go to ask about formal research, for example. There's always audits that can be done. There's always case reports. Many consultants have lots of case reports. They need someone just to write them. In addition, some hospitals, they will have ongoing projects where they will need someone to help with data collection. And data collection, yes, it can be very boring to do, but actually it's very useful to have that and to go through that process. That will help you to understand a bit more about what research is. You may even be able to get your name on a publication as well. Again, in most hospitals, most departments, there will be a consultant who is also a research lead. And again, they're a good place to go to ask about any ongoing studies, let them know that you're interested in getting involved in research. Nowadays, there are most departments, research departments, have research nurses whose main job is to conduct research, and it may be worthwhile contacting them, asking to shadow them, and to see exactly what do they do in research. Thirdly, in some departments you may find research fellows, people who are studying for a PhD or an MD, and for me, I found it very useful to speak to them, and because they know what you're going through, and they can give you advice specific to your department about the best way to get involved in research, and who's a good supervisor, who isn't a good supervisor, what type of products are available, what's it like doing that type of project. For some people, they do research on animals, for example. Some people do research on humans, and they can be very different in research. So in your department, I would recommend asking about any ongoing studies. If there are studies being undertaken, then ask to have a look at the study protocol. And if you go through the study protocol, every research study has a protocol which has been written beforehand, and they explain exactly step by step what the study involves, what is done, who does what, when a thing's done, and it's very useful to look through that, and you'll understand a bit more about how studies are undertaken. Also, have a look at the patient information sheet. So any research study, a patient that the patient is involved in, you have to give them a patient information sheet which explains in lay language what the study is about and what's expected of them, and it's very useful to read that, and because if you are going to be doing research, you need to be able to know how to write these type of information sheets. There is a good clinical practice course that is free, and it is valid, I think, for 4 years, and it is a really good course. I would recommend to go on. Anybody who is going to be taking part in research, they have to do this course, but it's useful to go on that course, and I think I think now it's an online course, so it's very useful. It goes through everything to do with ethics, everything about how to do research well and to be a good researcher. Lastly, most departments will have research meetings, and sometimes these research meetings are open, and if they are, it's good to find out when they are and to go and sit in and attend those meetings and have and just see how people talk about research and what type of research is being done. Obviously, sometimes the meetings are closed because if they've got any sensitive information, they don't want it to be leaked out. So it's always worthwhile just checking with the person who's running the meeting first before attending. Okay, so what is a journal club? Well, it is a meeting that usually lasts about an hour, and you have a speaker who is chosen to present some sort of educational material based on an article or a topic. Usually it's a formal PowerPoint presentation, but sometimes it can be informal, and usually the article is chosen in advance, and the article often is a research paper but can also be a guideline, and then the audience take part, they ask questions, and they can also apply their own critique of the presented research paper. Usually the article, I would recommend sharing the article in advance of the meeting, so that gives people a chance to go through the paper, and it makes it more, you get more out of the actual meeting. So a good journal club is educational, it is fun, and the more you do, the more enjoyable it can become. It is hard work for the person who's preparing the presentation, but again, the more you put into it, the more you get out. It's very good for the CV that you're taking part in journal clubs, regular journal clubs. It's also a really good opportunity to review the latest research, and it's it's also great preparation for people who are interested in doing formal research. So this is a sort of a practical step-by-step guide on how to do a journal club. The important thing is actually there's so many different ways you can do journal clubs, and this is my way, and it's not necessarily the best way or the right way, but it's a way that I've developed myself, and I think it might be useful to share that. So the first thing that I do when I've been asked to prepare for a journal club is make sure I choose a topic and a research paper. That's the first step. The second step is to get a copy of the article, and I put that in because actually sometimes it's very difficult to get a copy of the article, and sometimes I've not even been able to get the article. If I can't get the article, then I wouldn't recommend doing a journal club presentation. The third step is to read the paper and try to understand it. So I go through the paper, and I'll talk to you about how I go through the paper, and I just try to understand what the paper's saying and what the findings are. Then I tend to read around the topic, because often reading through that paper may generate some questions, so I go back and read around the topic. And then the fifth step is to critique or to evaluate the paper and draw conclusions. Step 6, I then prepare a PowerPoint presentation, and then step 7, present the paper. And these are the things that I will, and I will go through this in a bit more detail later on about how you go about presenting the paper. So first step is to choose a topic and an article. Usually the topic is depends on which specialty you're in. So if you're orthopedics, it's going to be an orthopedic topic, for example. I would recommend, if you're starting out, to pick a topic that interests you, or one that you're already familiar with, you have a bit of background. That might make things a little bit easier. But as you get more advanced, you start to pick topics that you may not know a lot about, and you want to use this as an opportunity to learn more about that topic. I recommend to try and keep the article recent, so within the last 2 years. I think if you got a paper that was published 20 years ago, then it may not be so relevant to discuss it today. But obviously, if it's a very good paper, a very big important paper within the last 5 years, say for example, this still may be worthwhile to present it. But usually for journal clubs, people expect something which is fairly recent. When you first start out, the first present time you've been asked to present, I would definitely pick a simple study design, something very simple that you can understand. The design of the study. It makes the rest of the talk much easier. So a randomized control trial is usually a very simple design, or if you have a large cohort study, again, it can be very simple design. As you get more advanced, then what you may want to do is to vary your topics based on the different design types, so that you learn a bit more about the different types of studies. So you may start off with a randomized control trial, then for your next presentation choose a cohort study. For your next presentation you may choose a meta-analysis, for example. Now if you're not clear about these different study designs, I've got a link to a website which goes through the very, very basics of the different study designs, and I'll put that link in the post. The other tips I would say is that if you're starting out, choose high impact journals, because they do often have the best research and the most sort of impactful studies. Also, bear in mind who is your audience, who you're going to be talking to, and choose your topic and an article that will benefit your audience. So a good website that you may or may not know about is called UpToDate. So www.uptodate.com, and it summarizes almost everything in medicine, many different topics, and it goes to the most recent up-to-date literature. So if you look at this, for example, I typed in cardiovascular disease secondary prevention, and this article came up, and as you can see here, the literature review was current up until September 2017, and it was last updated in October the 11th. It's a very good resource. It has a lot of references, and if you're not sure about what topics to choose, you can just go on there. UpToDate does require a license, so and a subscription, which can be quite expensive. But if certain hospitals they do subscribe to UpToDate, and if they do, then I would definitely recommend using that. So second step is to get a copy of the article. So you can search online. In fact, I haven't put it on there, but Google I find is also quite useful. But if you're looking for articles in particular, PubMed and Medline are the main places where I search for articles. Cochrane Library is a library of meta-analysis. Google Scholar also is quite good as well. So some articles are open access, and open access means that it's free to download and you can download the PDF. Otherwise, a lot of articles are not open access and you will need to have an account. One type of account is institutional access, and again, if you are working in a university or in a hospital, often they will have institutional access to that journal where the article is. So if you search for it on the computers at work, you may be able to get a copy of the article there. I would recommend everyone who's working in the NHS to get an Open Athens account, because this also gives you access to a lot of articles, a lot of journals, and it's free. If you're lucky enough to be in a university, again, you can get a lot of access to a lot of articles through a university account. Otherwise, the best place to get a copy of the article is if you ask your library. So you go to the library in the hospital, mention to them, I want this article or these articles, then they will be able to, most of the time, get those articles for you. Sometimes when I've had difficulty getting an article myself, I'll phone a friend, someone who's got some sort of university access, and get them to check it, because some universities don't have access to certain articles, whereas other universities do. It's quite variable. And lastly, once I actually had to email the author and say, I'm interested in your article, and I couldn't find it, would it be possible for you to send it to me? And I got it. Again, it's a good idea to share the article with the audience beforehand. That allows people to read through it, and it makes the talk more enjoyable and more interactive. So this is pubmed.gov. It is a search engine. So you have a search bar at the top here. You put in your words that you want to search for, and then you hit search, and then it gives you the number of results here. It tells you how many results there are and how many pages, and they list the results 1, 2, and you can scroll down. You can see it'll tell you the title, the authors, the journal, the year, and the publication details of that journal. So you can just click on, once you found your article, you just click on the link to get the article. On the side here, you can choose trials, reviews. You can check for articles that got free full text, for example. So this is quite a powerful search engine. There's a lot of things you can do on that. So you get the, so for example, this study I found on the New England Journal of Medicine. Again, when you try to download the PDF here, often it will ask you to subscribe, or will ask you to sign in. If you don't have if you're not subscribed to that journal, then you can click here where it says log in via Open Athens or your institution, and if you click on that, then this will come up, and you have an option here to log in via Athens, and you click on Athens and you put in your username and password. Or if you're part of university, you can click here and choose UK Higher Education, and then it will give you a list, and you just click on your university, and then it will ask you to put in your username and password. So this is Open Athens, username, password, and then you go back to the article again, and when you click on the PDF, it will allow you to download it, and it says here that the access was provided by your university that you are currently with. Okay, so the third step is to read the paper and try to understand it. So what I do is I start with the abstract, and I read that abstract to try to get an overview of the study, overview of what they did and the background and what the most important findings are. Then I go into the methods, and I spend a lot of my time, most of my time actually, reading through the methods in detail to see exactly what did they do, and there's loads of questions I ask. What did they do? What methods did they use? Have these methods been validated? What type of patients did they include? How did they include them? What treatments did they give? For example. So really go into a lot of detail with the methods of what they actually did. And often when you're critiquing a study, the main reason for the study not being 100% accurate, or any problems with the study, usually is related to the methods. Is the problem with the methods, or the way they did the methods leads to certain problems in the conclusions. Then I look at the results section, and I ask myself, what did they find out? What were the actual results, and what are they actually reporting? Then I go back to the introduction, and when I go back to the introduction, I focus on why did they do this study? What's the rationale behind this particular study, and have they explained the rationale in a simple manner, and does it make sense? And then I read their conclusions, and for that, what I'm interested in is how are they interpreting their findings. The results that they had. How do the authors interpret those findings? Because sometimes the way they interpret it and the way that I interpret it may not be the same. Also, I look in the conclusions to see what do the authors say that these results mean. So that's my approach for reading the paper, and often I'd have to go back and read each of these sections many times. Okay, so the next step is to read around the topic, and I try to aim to be the most knowledgeable person in the room when I give my presentation. Obviously it doesn't happen, but that's how much I try to read around the topic. I look at any up-to-date review articles, if there are any society guidelines for your particular specialty. And sometimes some societies they put out expert consensus statements. If there's anything like that, I read through it. Also, if there are any big landmark trials, big studies in the past that are important, I look through those. And again, if there are any recent trials which are also relevant, then I also look at them. what I try to find out is what's known about the topic, what is not known about the topic, what's the problem, what's the clinical problem, and what does this research paper hope to achieve or to add to what's already known. Okay, so the next step is to critique the paper and draw conclusions. This is probably a difficult step, and it's something that with time and practice you'll get better at. And when I first started, I was very bad at critiquing paper. I didn't really know very much, and but it is something that improves with time. As the more practice the more papers you read and critique, the better you get at it. So the first sort of questions I think about are, did the paper achieve what it set out to? In the aims of the study, were they achieved, yes or no? And I then make a list of the strengths and the weaknesses of the paper. Things I look out for is how well is the paper written? Is it presented in a nice manner? Is it easy to follow? Does it make sense? Is the English good? Look at, and then I also think about the methods. Were the methods good? Is this the best study design to answer the problem? Is this the best methods to use for that particular problem? For example, if you have a study looking at pulmonary embolism, what did they use to diagnose a pulmonary embolism? Did they just use a clinical history, an examination, D-dimer, or did they use a CTPA? So obviously, if they use a CTPA, then that's the gold standard way of looking at this. So that's what I look at. I then think about the statistical methods. Were the methods appropriate for this type of analysis? Again, statistics is very important in research, and I would recommend anyone who's interested in research to learn statistics, particularly medical statistics, so that you can really understand what the statistical tools, because at the end of the day statistics is a tool, and you have to understand what those tools are, because if you use the wrong tool for the wrong job, then you're not going to get the best outcome. So again, looking at the statistics, is it appropriate? Are the methods appropriate? Is the data presented appropriately? So how are they presenting their data? Are they doing it with graphs? Are they the right type of graphs for this type of study? Could they have presented it in a better way? Are the results presented in tables rather than in free-flowing text? Then I think about the ethics, funding, and conflict of interest. So all studies, research studies, should have some sort of statement about this, that there was a formal ethical review. Think about who funded the study. Was it funded by a drug company? Because that can sometimes give you a conflict of interest. If you have a big company has published a big study showing that their drug is amazing, then you just have to be very careful about that. And again, sometimes the authors may have conflict of interest because they may be getting paid by certain drug companies. So you have to think about that when you're looking at studies. And lastly, well, not lastly, but I also look at, very importantly, I look at the mechanisms. I like to look at what is the mechanism of this particular study, what they were looking at, and the findings that they got. What information does that give us about the mechanisms of any pathophysiology, for example? So if a drug works for a certain treatment, I'd want to think, has the study talked about the mechanisms of how this drug might be working so effectively. Also, if there are any insights into other areas of medicine, and also what are the practical implications for this that this study has in real life, in terms of how will it change how I manage patients, and in what way does it impact. And then lastly, I think about, and importantly, the novelty. So, when I read around the topic, I would have seen if there are any other studies, and the important question is, what is different about this study compared to the other studies? Is it different? Is it just the same? What does it add to what's currently known? Obviously, the more novel a study is, that makes it more, can make it more impactful. But also, it's useful to have a study which is where the results are similar to other previous studies. When you're critiquing a study, it's important to remember that not all negative studies are bad. If you've got a really well designed negative study, sometimes that can give you more information than a poorly designed positive study, because a poorly designed positive study may be inaccurate, it may be falsely positive. Whereas if you've got a good hypothesis and a well designed study and it comes back as being negative, then it still gives you a lot of information. And similarly, if you are performing research, you'll learn this as well. That what you'll find is that some people, they've told me that they've tried to do research and they couldn't get anywhere, and they were unsuccessful. They couldn't get their results published. And when I go back and ask them, well, what was the hypothesis? What was your scientific basis for your study, and what design did you do? What you'll find is often that's where the problem lies, is that they didn't have a very good hypothesis, and the design that they chose wasn't very good either. So the other thing to bear in mind is that I've mentioned that, and I recommended to go with high impact journals, but remember, they're not always perfect. They have got limitations as well, and sometimes there's a lot of politics between what is published and what isn't published. Again, industry sponsorship is important to think about. I've mentioned that before. Ghostwriting, you may not know about this, but there is some research articles, particularly in big journals and big randomized control trials. They're not actually physically written by the authors that are listed. There is someone who's a ghostwriter who will write everything out, and the authors will just check through it and make sure that they're happy with it, and if there are any additions that they'd like to make, then they would make it. Also, give yourself plenty of time when you're preparing for the journal club. Give yourself plenty of time to think about things, and don't leave it to the last minute. Give yourself plenty of time to go through it and spend time thinking about the study. Sometimes, I think about studies and articles and things like that for a few days without writing anything down. Okay, so step 6 is preparing the PowerPoint presentation. So it's important to be systematic in the way that you present it. I would recommend to avoid any animations or any fancy slide transitions, because they can distract the audience from the information that you're going to give, that you're presenting. Colours, very important. I was taught about this, that you want to have a good colour scheme, and good colour schemes are either dark writing on a light background, for example black on white like I've done in this presentation, or dark blue, for example, on a white background, or you have a light colour on a dark background. So for example, you can see here white writing on a black background, or white writing on a dark blue background. This is very important, not just in regards to this particular for the journal club, but just in general. As you can see, here's some examples of a bad colour scheme where you've got a light writing on a light background, or a dark writing on a dark background, which is more difficult to see. Avoid too much text, small writing and complex figures. Avoid the colour red. It's very important because some people, they can't see red very clearly, and sometimes it doesn't always project very well. And that's the other thing to think about is where are you going to give the talk, and what type of projector do you have, and it might be worth testing your PowerPoint presentation out beforehand, just to make sure it looks how you expect it to look. I would always recommend including original data in your PowerPoint presentation. This way it gives the audience, they may not have a chance to go through the paper beforehand, it gives them the chance to look at the data and interpret it for themselves, and that will help with the discussion and the audience participation later on. If you don't have the original data, then you're not going to be able to, you're going to limit the discussion. So again, this is a bad example of a colour design. Again, this is bad. Again, this is bad as well. The colours they're very similar, and this just doesn't stand out as well. This is good. Like I said, avoid too much text because they're not going to be able to read all of that. Again, if it's too small, if the writing is too small, just leave it out. There's just no point having such small writing. The other thing is to avoid complex diagrams. So both these on the left and the right are diagrams showing the mechanism of how statins work. The one on the left is very detailed, fantastic, very detailed, but it doesn't work well in a presentation. It's just too much information, too complicated, and you can't expect the audience to go through all of that in the space of a few seconds. Similarly, if you, on the other hand, if you look on the right hand side, this is just so much cleaner and so much neater, and it's just less. There's less writing there, so you can focus on what the important things are. The last step is to present the paper, and I start off by presenting the background, and in the background I try to limit it so that it's not too much, but basically it's just the right amount of information that's needed for the person to understand the study, what the study was about. So usually it's a few slides on the background. Then I go through the methods, and I try to just make it very simple to describe what the authors actually did. Sometimes a diagram is more useful, particularly when you're describing a study design, and sometimes you can find a good diagram in the method section of the study itself. Sometimes they have it in a supplementary data. So if you when you publish a research study, you have the main article, and in the main article it's just very succinct, summarizes what you need to know, and then you can have a supplementary file where you go on the website and you go on the side, and then you can download the supplementary file, and often they'll put in more details and sometimes some nice pictures of the study design. You might find them in the supplementary data, so I would look in the supplementary files. Then I present the results, and I always include a summary of the results. Then I then describe what the author's conclusions are, and then I present my critique of the paper. So I just talk about the strengths, the limitations, and my own conclusions about the study. Then I try to place the current research paper in the wider context of what other studies have done, what the rest of the literature is like, and what can we learn from this particular study, how we can apply it in real life, and also what the next steps are. What future studies are needed. Then I give the opportunity for the audience to participate, and if they want to ask any questions or if they want to have any comments, they can do that at the end. The other thing is very useful to print out a copy of the paper and bring it with you on the day, because often you'll find somebody will ask in the audience, they'll ask a question about the methods and you don't know, or they'll ask you a question about results or something, and you just can't remember everything. So you can refer to that paper, and even you can give it to them. You can give them a copy of the paper and say, look, read it yourself. If you have any specific questions or detailed questions. And that is the end. So I hope you've made use of this, and I hope it's useful. Please feel free to ask any questions and post the questions, and we'll try to get back to you as quickly as possible. There will be hopefully another session, which is a live session where I will go through a live example of a journal club presentation, and we'll keep you updated about that. Okay, thank you very much. Assalamu alaikum.